Hi guys, Dr. Kid here. In this video, I'm going to go through a review of the medication Agomelatine. I'm going to go through some of the unique properties this medication has as an antidepressant, how to take it for the best effect, how does it work, and what are some of the key side effects to look out for. So Agomelatine, otherwise known by the common brand name Valdoxan, is an antidepressant medication that has unique properties. Now there's a wide range of antidepressants now to choose from, and if you are deciding to start an antidepressant medication, what clinical situations would make you choose Agomelatine as your antidepressant of choice? Well, in my mind, there are two key features that differentiate Agomelatine from the other antidepressants. The first key differentiating feature of Agomelatine is that it assists with sleep. This is due to the fact that it activates melatonin receptors as its main mechanism of action. Melatonin is a chemical that's naturally produced in our body when we sleep. Therefore, if you're a person that's looking for an antidepressant or an anti-anxiety medication, and you have concurrent issues with sleep, this may be a good option for you. The second key feature of Agomelatine is it tends to have a lot less side effects compared to other antidepressant medication. This is because Agomelatine has been shown to have no effect on histaminergic, adrenergic, dopaminergic, cholinergic, and benzodiazepine receptors in the brain. These are a wide range of receptors that are commonly found in our brain, and activating these receptors has a wide range of positive and negative side effects. Now, although you might think this might be implied that Agomelatine will not activate these other receptors because its main mechanism is to activate the melatonin receptors, this is actually not the case for other antidepressant medications. For example, one of the first classes of medications that were used to treat depression were the tricyclic antidepressants. These medications activated a wide range of these receptors, and therefore patients were more susceptible to more side effects. Even more targeted antidepressant medications, such as the selective serotonin reuptake inhibitors, or SSRIs, which primarily work on serotonin, still have some effect on those other receptors mentioned previously. This is why clinically, Agomelatine presents with much less side effects compared to traditional antidepressants, including gastrointestinal side effects such as nausea and constipation, and also does not tend to affect sexual function. This is why, if patients have a significant concern about side effects on antidepressant medications, Agomelatine may be a good option. So how do you take Agomelatine for its best effect? Well, Agomelatine is best taken at nighttime because it helps with sleep, and it's taken with or without food. Agomelatine comes in 25 milligram tablets, and the typical dosage range of Agomelatine is between 25 and 50 milligrams. Because there is no 50 milligram tablet, usually if you're taking the 50 milligram dose, you'll take 2 of the 25 tablets. When taking Agomelatine, it's recommended that you regularly monitor the liver function test. This is done by a simple blood test. The reason for this is that a small amount of patients taking Agomelatine will have a significant derangement in their liver function tests. This occurs in approximately 1.25% of patients taking the 25 milligram dose and approximately 2.6% of patients taking the 50 milligram dose. The recommended times the liver function tests should be tested are before treatment starts, at 3 weeks, 6 weeks, 12 weeks, 24 weeks, if you increase the dose to 50 milligrams, and whenever clinically indicated after that point. If during treatment there is a significant rise of the liver function test more than 3 times the normal limit, or there are signs of liver injury, then the treatment should be stopped. Signs of liver injury can include jaundice, which is yellow discoloration of the skin, light coloured stools, dark coloured urine, or right upper quadrant pain, which is pain just in the upper abdomen here. So who should not take Agomelatine, or what are the contraindications to Agomelatine? Well, the list of this is actually relatively short, but the contraindications of Agomelatine are a history of anaphylaxis using Agomelatine, a history of severe liver disease such as cirrhosis, and the concurrent use of potent CYP1A2 inhibitor medications. CYP1A2 is an enzyme that's found in the liver and is primarily responsible for breaking down Agomelatine to make sure it doesn't overaccumulate in the body. If you have other medications that inhibits this enzyme and therefore the body cannot break down Agomelatine, this will lead to increased levels of Agomelatine in our body and therefore increased risk of side effects. Two examples of potent CYP1A2 inhibitors include fluvoxamine, which is an antidepressant medication, and ciprofloxacin, which is an antibiotic. So that's my summary of Agomelatine. If you found it helpful, make sure that you like and subscribe to the channel, and I'll see you in the next video.